morning and welcome back. This April, in honor of Donate Life Month, Hartford HealthCare is celebrating a remarkable increase in organ donors. With record numbers coming forward to give the gift of life, we'll explore the impact these donations are having and what you need to know if you're thinking of becoming one yourself. Joining us this morning, we have Dr. Oscar Serrano, transplant surgeon at Hartford Hospital. Doctor, first of all, thank you so much for your time today.
Thank you for having me. Good morning.
This is so important. We are talking about life-saving donations here. First of all, over the last few years, Hartford HealthCare has seen a record number of organ donors, which is very encouraging. What do you think has led to the increase?
Well, I think it's several-fold. Last year, the U.S. performed about 48,000 organ transplants, which was about a 3% increase from 2023. These gifts could not have been possible without the 23,000 organ donors that made it possible. What has led to this increase is probably a combination of public perception and acceptance of organ donation and transplantation, education about and demystifying the organ donation process, and then improvements in donor management and techniques that have made donors that were previously ineligible are now given the opportunity to donate.
Not everyone knows exactly what it takes to donate an organ. You know, you get that form for your license, you check the box, but really, what are the requirements to become an organ donor and how can you really get started?
So they're actually very simple. Potential donors must be in fairly good physical condition. That's obvious. Their medical history is probably should be minimal. They must be able to make an informed decision. So either they themselves through signing that little checkbox on the credit card, or letting their family know so that they can make decisions for them. And the donation must be voluntary and uncoerced.
Okay, and with such a growing number of donors, what changes have you seen in the transplant program's ability to save lives and improve outcomes? Must be great.
It's phenomenal. So we at Hartford HealthCare have a very comprehensive transplant program, and it's evolved to be one of the largest in the Northeast. We understand that we have a unique situation nestled between New York City and Boston. We also know that many of our patients are underinsured, and so we're proud to serve this large portion of patients, many of whom are minorities or non-English speaking or from rural communities. Within the last few years, we've really have increased in size in terms of physicians, nurses, and coordinators who can help take care of many of these patients.
All right, you know, there may be one person watching right now who thinks, hey, you know, this is something I've been curious about for myself. What would you like to say to potential donors who may be curious about donation and what they need to do to take that step?
Sure. I think organ donation is probably one of the kindest and most simple ways to say I care. The World Organ Donation Day of last year had a theme that had be the reason for someone's smile today. And the significance of that is that organ donation saves lives. That's true and true. It gives people a second chance to live. So it gives someone else a chance to live. It gives the donor an opportunity to live on. And it gives people an opportunity to be the silver lining in the midst of a storm of an untimely death.
Dr. Serrano, such important information. Thank you so much for your time today to talk about it. I really do appreciate you coming to us from Hartford Hospital. Thank you.
Thank you.